Richard, what can you tell us?
Well, Aisling, as you said, there was a drop once again in the number of people waiting on trolleys or in chairs in emergency departments or in other parts of hospitals across the country. That is to be expected, though. You always see the busiest time in hospitals at the start of the week, Mondays and Tuesdays, and then gradually you'll see the staff be able to clear the backlogs, see as many patients and whittle that number down. So down to 535 today, according to the Irish Nurses and Midwives Organisation and their Trolley Watch count. They say that the Executive Council of the INMO is meeting today in emergency session concerning HSE action in relation to the current hospital overcrowding crisis. And it is what they want to see the government do, is declare the situation a crisis and cancel non-elective care in hospitals across the country. We are outside the rapid injury clinic of the Mater Hospital in Dublin, here in Smithfield in the north side of the city. The Health Minister Stephen Donnelly due to visit the clinic a little bit later on. Staff, though, who have been fighting this on the front line, this current situation, since the end of last week, where you had more than 1,800 people waiting for 24 hours or longer for a bed in Irish hospitals. They say the situation is completely untenable. They cannot provide dignified care to patients at this time.
It's tremendously frustrating, demoralising for the professionals in that environment, and they leave and they find other environments where they feel more fulfilled, where they can do their job and where they're not apologising, stepping around people.
Well, as you're saying at the beginning there, Aisling, there is a view in the HSE that the worst of this may not have arrived as of yet. You have seen, a record number of people on trolleys at over 900. There is nobody ruling out the fact that we might see over 1,000 before we get to the peak of this trolley crisis. And that is because you have not yet reached the peak of the flu season. That normally comes about midway through the 11 to 12 weeks of an annual flu season, which could last all the way until April. So people in the HSE really organising things. They say that this is really they're organising and gearing everything towards trying to address the capacity problem. That will see senior clinicians on the front lines over weekends as well. Senior clinicians, though, do have a bone of contention to pick with the Minister for Health, Stephen Donnelly, over his call for consultants to work weekends. They say they're already doing that and they're going above and beyond in pursuit of trying to rectify this situation.